you all so much for joining us tonight, and thank you to all of you guys at Sunrise for joining us. I know you guys have busy schedules, so we really appreciate it, you guys hanging out with us tonight. One thing I just really wanted to say to everybody, if anyone on here is not already an EM member, I highly encourage you to become one. There's a ton of benefits as students, tons of ways to get involved. So I will put a link in the chat. I'll put a link in the chat. That's a link to our webpage. It has all of the student benefits on it. And then I will also put a link to our social media page, which is super active, always stuff going on. And then I will also put a link to my email address. So if any of you guys have questions throughout the series or questions regarding AEM, I'm happy to answer those, or I will reach out to someone who can answer those questions. So thank you again. And with that, I'll hand it over to you guys. If y'all want to introduce yourselves and say what your role is with the program, that would be great.
Yeah, hi. My name is Dave Hart. I am the program director for Sunrise Health Emergency Medicine. And Dr. Mogg, do you want to introduce yourself?
Yeah, I'm Dr. Hayden Mogg. Thanks so much for having us and joining us. I'm a core faculty and a graduate of the first class of the Sunrise program. With us today, we have Dr. Duncan Williams as well, one of our second year residents. And joining us in a little bit is Dr. Nate Epstein. He's actually on his ICU rotation right now and got called away to do a consult, but he's still nice enough to give us a little bit of his time. So he'll be jumping on it a little bit.
Yeah, I thought we would start by giving you a bit of a presentation about who it is that we are. And then I was told that I have about 15 to 20 minutes to go through this, and then you can ask some questions a little bit later is my understanding of how this works. Let's see. So Hayden, are you able to put that into like full slideshow mode? Great, perfect. All right, this is us. Go to the next one. And in case, so some of you are interested in us because of Las Vegas. Others of you are interested in us in spite of Las Vegas, is what we found. And just to give you a little bit about Las Vegas. Las Vegas, when most people think of Las Vegas, they think of all of this. There's amazing downtown shops and casinos and amazing hotels. And all of that is definitely part of what Las Vegas is. If you want to shop and spend all of your money, you can. If you want to eat to your heart's content at world-class restaurants, you absolutely can. Next one. We've recently become we weren't always, but in the last 7 years, we've become quite the sporting town. We have the Golden Knights, we have the Raiders. F1 started here last year. Dr. Mogg actually got to work the F1 race this last November. So we've become quite the sporting town. And if you like golf, there's 50 plus golf courses here in town. So it's whatever you want. But let's see, go on to the next. Oh, yes. And if you're not into like big, giant hotels and things like that, we also have a really fun downtown swanky arts district place that's got fun sort of antiques and cool bars and things like that. Las Vegas is not just all big and gigantic. And if you are not into the downtown stuff, or if you're into the downtown stuff, but really love to get outdoors, Las Vegas is an outstanding place to get outdoors. This is Red Rock Conservation Area. I rode my bike here today, actually. I got there. I can get to this area in Red Rock in about 45 minutes on my bicycle. So this is literally just outside of Las Vegas. Next. And if you're into water sports, the famous Lake Mead is right here with Hoover Dam. That middle picture looking at the bridge across the way, that's actually taken from the Hoover Dam. Lots of fun recreation on the water. Next. And anything else your heart desires is within just a few hours drive of here. Zion National Park. You can ski in just an hour from Las Vegas. There is skiing and all of that. So just in case you're worried that Las Vegas doesn't have what you want, for most people, it really does. I moved to Las Vegas 10 years ago, not thinking I'd stay, and found that I really just loved it. Never wanted to go anywhere else. All right. That's where we are. So Mountain View Hospital is our main site. Mountain View Hospital is a suburban hospital, community hospital with 82,000 annual visits. There are 15% of those that are pediatric visits, very high acuity. We have about a 30% admission rate, 8 to 10% ICU admission rate. And we have most major specialties, but they don't all have residencies. That means you don't have people breathing down your neck to take away your procedures. They're all yours. Our secondary site is actually the larger of the two, Sunrise Hospital. It's located just off the Las Vegas Strip, about a couple miles east of there. It is in a very urban location. They see over 150,000 annual ED visits. I just got an email today that we saw the most visits we've ever seen at Sunrise this week, 440 in one day with 206 EMS rigs. It is a very busy hospital, very high acuity, 30 to 35% admission rate, 10 to 12% ICU admission rate. So all major specialties, major stroke center. You may have seen us in October 1st, 2017 shooting. We were probably the major center seeing patients for that disaster. And it was one way that our hospitals came together and showed what we could do, and also one way that our community came together and showed what they could do. Our pediatric experience is also at Sunrise Hospital, or rather our pediatric emergency department. They see 55,000 annual visits, have most major pediatric specialties, and most of our clinical faculty are pediatric EM trained. One thing that's a little different about our program is we have a different way of running our didactics or our conference days. We have what's called Malcolm, the Modular Active Learning Curriculum for Emergency Medicine, that was developed by Dr. Michael Allsweed, the program's founder and first program director. I learned under Dr. Allsweed and took over the program from him as director about three and a half years ago. So the way this works is essentially it's based upon adult learning theories that were pioneered by this man, Malcolm Knowles, which is how it got its name. And the idea is that adults don't learn the same way as kids. So why treat adults like kids? So what we do is instead, adults need to have multiple ways of learning things. They need it to tie back to their experience. They need to see it multiple times and see how it's important to their day-to-day life. And that's how you remember things. So that's what we try to do. So first we have 50 to 80 pages of reading per week. We give people time for this. In fact, nobody works the day before our conference day, the night before. So everyone's off out at about 7 p.m. And then the day of, after everyone's done their reading for the week, we then come together and have a flipped classroom discussion. It's our job as faculty, if we're doing our job right, we are not teaching you everything, but rather we are guiding a conversation in which you teach one another the major points. Next, as part of this, so you've got the reading, and then you have the flipped classroom discussion, and then after that you have the simulation element. Simulation, we have a very nice simulation center. We do simulation every week. In fact, we run two to four simulation scenarios per week. And the idea is that we put you into a scenario that is going to reinforce those things that you have learned during your prior discussion and reading. We can train pretty much anything that we need to train in our simulation center. We're very well stocked, and everybody who comes in as an intern in their first 4 weeks, we train all of you on the major procedures of emergency medicine in our simulation centers, so that when you go and you're actually working on real people, you have a bit of experience, muscle memory there. Coming up, in fact, in 2 days is our annual mass casualty simulation. Dr. Menina has actually left our program, unfortunately, but this was her baby and she's actually still running it. Her husband got a job at the Pentagon, so she decided to go with him. But she still takes an active part in this. And the reason is it's a huge effort to coordinate hundreds of volunteers, hundreds of EMS and other public safety people who come together, and we all run this simulation together. They bring us patients, simulated patients from the scene of the disaster. And then we triage them and treat them as simulated patients in our emergency department. My understanding is that we have over 100 volunteers for this event coming up. Big event, very cool. Next. We do have a different curriculum for our seniors that I won't belabor here, but essentially we want them to get into the literature a little bit more instead of more just textbook sort of stuff. Actually understand why it is that we do the stuff that we do, and train you for your oral board preparation, which is now becoming a new sort of exam, but we want to train you for that. Next. And then we also have plenary lectures. We do have a plenary lecture in the morning, and then we have a noon rounds in which we discuss different topics. And this is more traditional sort of lecture based thing like we're doing right now. Next. These are our rotations. So nothing super out of the normal here as far as what you're going to rotate and do, but maybe it's worth highlighting. We have a 2-week ultrasound block in your first year, and then another 2-week ultrasound in your second year. We also have electives in both the second year and the third year, and then you get some freestanding ED experience. The trauma experience is all done at our trauma center at Sunrise, and then pediatric ICU and our other pediatric emergency experiences all at Sunrise as well. Moving on. And then research. Everybody is required to do some sort of academic or scholarly activity. That's true for every residency around the country. Our job is to make sure that you feel like you are doing something that's worthwhile and that you are getting through it in a way that does not feel too painful. And we recognize that not everybody who comes to our program has a huge interest in doing research for the rest of their lives. So our job is to get you familiar with the process and make sure that we see you through and have you do something worthwhile. Oh, I did fail to mention the Southwest Regional Emergency Medicine Conference is a conference that we put on every year. You are welcome to come join us. It happens usually the last Friday of January. And this is where we have residents and students come and join us, and we get a chance to all have multiple residencies together, to have lectures and learning together and competitions, simulation competition, ultrasound competition, research symposium, and it's all run by our program. It's a really great event for our community. Wellness is important to us. We both from the side of we want you to be well and be able to get involved in the things that you want to and have time to spend with your family and with your friends and people who are important to you. We also have the opportunity. HCA has a lot of good resources for mental health for people who just need somebody to talk to, or they need some sort of advisement, whether that's financial or mental health or whatever that may be. And then we love to spend time together. So we have different events throughout the year. These pictures are all from our holiday party in which we theme every year. And this last year's theme was Space Cowboy, as I recall. Yeah. And we have a great time doing that. We also have a yearly, this isn't showing up perfectly, but that's okay. We have a yearly retreat to Mount Charleston where we rent out the cabins and get a chance to hang out together, get to evaluate the program and discuss what things that we can improve. And then we get to hang out, barbecue, and have a great time together. This is just, believe it or not, 40 minutes outside of Las Vegas, beautiful mountains. And then Women in Medicine, in fact, they're holding an event right now. In fact, I think that's why we don't have any females on the thing right now is because they're at a Women in Medicine event. But an opportunity for women to discuss issues within medicine, and they hold these events. I think they try to hold them quarterly. And our incoming class is over half female. We want to make sure that we have things that are there to support them. Next. And then Wilderness. Wilderness is a great event that we put on every year. Usually we do it in the fall. This is wilderness medicine plus wellness put together. We have all these wilderness medicine activities and learning that we do together. Usually we have people with special skills in wilderness medicine come and talk to us. And then we barbecue and camp out overnight. You are not required to camp if you don't want to, but if you're willing to, we want you there. And then the next morning, we run a bunch of simulated scenarios for wilderness medicine. It's a very popular, great event that we do. Next. And this is our faculty. This is me. Dr. Rosendahl is at Women in Medicine right now. She's my associate program director. Dr. Dunnigan's been with the program since the beginning. He's the chair of the department. Very great advocate for the program with the hospital. Alex Daves and Samantha Chin. They are both our ultrasound faculty, both ultrasound fellowship trained. Oh, this is old. So Shalise O'Brien was replaced by Dr. Yaron Ivan as pediatric emergency EM director. Amber Mirajkar is over research. Frank Lee's been here since the beginning as well, does the EKG curriculum, works with the students. So he may be your first contact with us. And then Dr. Crystal Turgis, Dr. John Rushton, Dr. Turgis and Dr. Mogg joined us recently with the faculty, tons of energy, lots of great things. Dr. Turgis is helping to take over the mass casualty. Dr. Mogg helps us with all sorts of great things, including events like this. And Dr. Rushton is our simulation director. And and this is why we do what we do. We as a faculty are very, very interested in doing the best we can to make a great experience for our residents. Our residents really do have just an outstanding clinical experience. So they go on to graduate, and our residents are known in our community as being excellent emergency doctors who can make it in any environment. So we are very proud of that fact. And and those who have desired to go on to fellowship, we've been able to place them in really great fellowships and almost every type of fellowship you could imagine. We've been very successful, even though we're a relatively new program, just 8 years old. And we've come and done some really great things. With that, thank you very much for your time. And thank you so much for letting us do this. And we'll take some questions. Is that right?
Yeah, if anyone's brave enough to turn the camera on, you're welcome to. If anyone has any questions, go ahead and ask. If we get too much of an awkward silence, I will fill the space with questions.
That's great.
Any questions for anyone online? Oh, we have a hand. Shane. Y'all can also put questions in the chat and I will read them. Shane, did you have a question? I just want to say hi. Justin? Anyone?
I misclicked.
Oh, okay.
So
Alrighty.
anyway, how about we have Dr. Williams introduce himself since he was a little bit late joining. I didn't get a chance to talk. So maybe Dr. Williams, you want to tell us how you came to our program?
Yeah, I'm one of the current second years. I actually came about through the soap, but I think I landed exactly where I'm supposed to be. Emergency medicine is something that's high energy. It's new every day. It is very challenging, but it's also probably one of the more rewarding things. They'd say it's very uncommon. It's not very often that you literally save someone right in front of you and take them from the brink of death to moving on to the ICU or wherever. And sometimes you get to see those people go home. So something that emergency medicine has, I don't think a lot of other specialties that take a lot longer, multiple patient visits to see maybe changes that you're providing. That's something that's special. In terms of Las Vegas, I'm from California. I've lived all over the country, like Canada and the East Coast. I thought Las Vegas was all the dirty housing that's outside the strip. So I was scared. But when I came out here and then like all the housing everywhere is beautiful. You get anything that's just within 20-minute basically circle of the strip and like the major central area is range of affordable but nice and safe place to be to like ridiculous mansions on golf courses and stuff like that. There's everything you could possibly want to do here. You don't have to do any of it, but it's all available. Dr. Hart mentioned at the beginning, if you're outdoorsy, half our residency does nothing but climb, it seems like. And then otherwise we
Mountain
have
bike.
right now in hiking. And then otherwise we have I'm a big like foodie, so I like going to the restaurants and seeing all the new places. It's like some of the greatest food ever here. Go down to Chinatown and just pick a spot, and it's probably better than most places you've been before. I think there's something for everybody here, and I think Las Vegas is an affordable place to be. Our training is outrageous. It's so far beyond what other programs often get to provide, and the amount of crazy, weird procedures we get to do, and the quality of patient care we have to deal with all day long is, I think, something super special.
Dr. Williams, why don't you talk just a little bit about what Mountain View versus Sunrise have to offer and why that gives you such a nice experience or broad range of experience?
Yeah, certainly. I think Mountain View seems to be more like your typical community hospital. In our area, it tends to be, from my experience, somewhat a little bit older. So you're getting people with more complexities. They're not always coming in like immediately super ill, but then you find out the pneumonia they have with this complex COPD heart failure patient is significantly more difficult to manage than the 25-year-old pneumonia. I'd say you still get quite a bit of procedures and ICU time, things like that at Mountain View. Then you go over to Sunrise, and Sunrise is a more urban population, a lot more people suffering from homelessness or just a lack of primary care, essentially, and a lack of follow-up. So you get people who are very ill from all kinds of wild things. There's a lot of drugs, and all the traumas are over at Sunrise. So I think between the two, we get all the benefits of the community hospital and learning how to manage some primary care stuff. And then you get the urban, like, people just dropping off gunshot victims and stuff like that at Sunrise at a ridiculous volume of patients. So you get to balance being extremely efficient and effective emergency medicine physician while seeing just the greatest variety of everything all the time. I think we're super lucky to have that.
And because
I'd
it's right off
also,
the line. Yeah, sorry. I was just going to
you
say,
took the
just
words right
because
out of my
it's,
mouth.
yeah, because it's right off the Las Vegas Strip, people from all over the world, and they're
Yeah.
coming in for anything from just needing a little checkup on a cough to like some of the most outrageous and odd things that the world has to offer. So
I remember when I was an intern, one of my first shifts at Sunrise, my first patient of the day at 6 or 7 a.m. was a stripper in anaphylactic shock. I can't imagine there's too many places in the world that you could compare training in emergency medicine in Las Vegas. That's what drew me to this program initially. I had never actually been to Las Vegas until I interviewed with the program 7 years ago. But I figured, man, if I could train in Las Vegas and all the craziest things that they see, I think I could go anywhere. And that's certainly come true.
I was gonna ask if one of y'all could give a glimpse into what a day in the life of an intern is.
I think we have an intern with us.
Yes.
Nate, are you with us? I thought I said Nate on a second ago.
yeah, I'm here. Hi.
There we go.
There you are.
A day in the life of an intern is working in the ICU all day, not having any admits, and then 10 minutes before you're supposed to be on a Zoom call, you get intraparenchymal hemorrhage, and then you're in the ED admitting that one to the ICU, and your attending grabs you and says, "We have to intubate this other room because she's got an epidural and is going to the OR." So I apologize for being late.
I think
No,
that's a pretty good excuse.
That's
Yeah.
the answer I expected.
Yeah, that was so. I'm Nathan. I'm from Las Vegas. Lived kind of everywhere else. Went to school up in Idaho, Kentucky, back to Idaho. And yeah, so day in life at the end of an intern, we do about half of the year. Our first year is on service. And so that means we're in the ED, either at Mountain View or at Sunrise, working shifts. And then the other half of the year, we front load a lot of our off service rotations. So things like cardiology, anesthesia, ortho, MICU, medical ICU, trauma, consult service. We do our first year, and then those things are able to build on each other year after year. You end up spending more months in the ED, less months on off service rotations. But in that way, we're able to actually like a pretty good foundation of really how not only like the healthcare system operates optimally, but also when it operates suboptimally, what can we do to be better for our colleagues on the floors? How can we best stabilize the ICU patients, best help our trauma colleagues be successful when polytraumas come in, be prepared at Mountain View, which is not necessarily a trauma center, but that does not mean that there are not traumas that will come in. And so intern year, like getting your feet wet in a little bit of everything and then being able to hone those same experiences throughout the year.
Some of the things that sometimes I forget to mention real specifics. So the interns work 17 shifts per block. So blocks are 4 weeks. So 17 shifts per block in their first year, 16 in their second year, and 15 in their third year. You will see as you get introduced to other programs that is fewer than most. The reason we do it that way is we want you guys both to be able to spend times doing the things you love. And then we also want you to be able to read because that's a big part of our curriculum. We give you that time through that schedule. The shifts are 10-hour shifts, and we typically have you stop seeing patients about 2 hours prior to the end of your shift so that you can clean things up. That's a couple of specifics that people like to hear.
Looks
And
like we have a
uh,
question. Oh, do you have anything to
yeah,
say?
I was
Lee?
going to say, Shane, to answer your
Yeah.
question in the chat there. So the question was about mentorship and how the different you develop right through the years. And you kind of hit the nail on the head there, Shane. So Dr. Williams, one of our second years, is one of three who work directly with not only the interns, those for our first couple of months, but also the medical students that rotate through fourth year. So him and two of his colleagues every week will put on didactics for the medical students who rotate through and then work on scheduling them with mostly second year residents and then also occasionally some third years. And then towards the end portion of intern year, we start to work with med students, but begin to take on more of a leadership and mentorship role. So that way, when we become second years, those first few months, they try to co-shift, if you will, as you go. So by that, I mean myself. And if I was a first day intern, there's going to be somebody else who's a second year or third year that's going to work the same shift with us, not only to be able to bounce ideas off, but also help with some of the flow of the department at Mountain View and at Sunrise. And then throughout didactics, the first years and second years work closely the entire way through. The first half of the year, the second years run our sims every week. And then the second half of the year, interns run sims and second years are in the room to help and to assist as needed. So that way we get to continue to develop and they get to see how to operate as a supervisor, as a mentor, and as a colleague in a different setting. So yeah, there's definitely a key note on mentorship and leadership, I think, in the program.
Yeah. I'd also add to that, really any program you go to, the transition from fourth year med student to intern it's a big jump and it's a tough one. You go from one day not being able to order so much as a Tylenol, and then the next day someone gives you a PIN number and you can order a $10,000 workup with 3 clicks. It is a big jump no matter what program you go to. What I think, and I echo what Nate says, I think our program does a really good job of getting people eased in. The first month, like Dr. Hart mentioned, is our intern boot camp where we go over all the procedures. This is how you do a chest strip. This is how you do a central line. This is how you work our EMR. And then you're usually paired or around other senior residents and faculty who know that you're new, that know that there's still a lot to learn, to bring you up to speed. Because like I said, no matter where you go, it's a huge transition. And having that backup and that support is everything.
We also have a formalized mentorship program in which residents are paired. They choose their faculty mentor, and they also choose a resident mentor in the class above them. The faculty mentors have formalized interactions with the residents in which they go over like their goals with them on a semi-annual basis and are there to help them work through what it is that they want to do during residency, how they're doing as they're going through it, and how they can help. We do try to formalize that process as well.
Yeah. I think we have a generalized culture of mentorship. Anywhere you go, there's going to be a senior who's on a shift, even sometimes off service. Like I'm on ultrasound right now. I make my own schedule. But if I see an intern going to do procedures, I go supervise with them. I teach them how to do what they need to. That's the general consensus with everybody. I remember when I was a first year, I learned from second years, third years, I didn't do basically any procedures without somebody being there to walk me through. When I was on ICU, you learn everything from your seniors. So it's all, I think we push a culture of I want to help you advance. I don't want to grind you through residency. It's already hard enough. And so we try to give each other every leg up we can and have compassion for each other, knowing, You don't need to see 25 people when you're an intern, not even a second year, right? But you want to push numbers when you're ready and your skills can match that volume.
And that being said, I'm working with an intern tomorrow. And if we have a cardiac arrest patient come in, I'm having him run it. Everything, if you feel up to it, you feel capable of doing it, you're going to get your chances to prove what you can do.
I think we should answer the last question first, and then we're going to go back to Adriana's. So we use Meditech, which is not a good EMR. So I'm sorry, but everybody gets used to it fairly quickly. It's not the worst thing in the world. It's just not that good. That's the answer to that question. I think
We'll add though, we do have dictation software, which
yes,
for whatever program you guys go to, that should be an absolute must. I will never work a job, no matter where I go the rest of my career, that does not have dictation software. I cannot stress to you how much of a time save that is. So no matter where you go, make sure you have a good dictation software. We have something called Immodal, which is, in my experience, is better than Dragon. I've used both. That is a total game changer. And when you guys start making your list next year or in a couple of years, make sure that's on it.
we also have Scribes, which we allow the second and third years to use. That's also a way that we make the EMR a little less unpleasant. And then to go back to Adriana's question, I hope I'm saying that. Sorry. So as a neurotic second year, it's certainly normal to be interested in what it's going to look like as a 4-year residency. I can only assume that ACGME's proposed changes are probably going to include that 4-year clause. What we have talked about is making that senior year a little bit more of a pre-tending shift to have those 4th years acting in a more leadership role in the emergency department and running the cases with the lower class residents, and then the attending will be there to spot check. And so we hope to build that for our residents, because I know what ACGME wants from their residents from this 4-year program, and that is people who are ready to be attendings as they come out of residency. And that's difficult a lot of times, especially if you haven't seen enough patients or if you haven't had a chance to run a department. What we will probably have a required administrative rotation in which you get to figure out what it's like to actually see what the administrative side of the emergency department looks like. We will probably reduce the shifts to fairly low so that you can do quite a bit of moonlighting. Our residents are allowed to moonlight in their 3rd year, and we would love to give the 4th years an opportunity to do plenty of moonlighting if they want to. And other than that, there are lots of experiences that the ACGME is proposing that we require. Many of those we already have built into our curriculum, and the ones that are not already built into our curriculum, with 1 or 2 exceptions, we should be able to handle pretty easily between Mountain View and Sunrise. I am not worried about the 4-year thing. I'm not entirely enthusiastic about it. And yet I think that when that 4-year requirement comes along, we are going to be primed to be an excellent residency in that function as well.
And I'd also add, one of the other proposed changes from the ACGME is to increase the number of procedures required. It's like you have to have, I can't remember the exact number, X number of intubations, X number of central lines, X number of chest tubes, things like that. The number of procedures that I'm sure Dr. Williams and Dr. Epstein can back me up on is certainly not an issue here. I remember I had my needed number of intubations to graduate sometime, I think December of my intern year, and central line's about the same. Our residents get no shortage of procedures, no shortage of truly sick patients, just about every variety. It's a very great place to train.
Yeah, I think that 4th year is going to matter more in certain areas, especially places that don't have as high volume. If we did not have Sunrise at all, I think that 4th year would be not necessarily necessary, but I think it would be highly beneficial. The fact that we have both hospitals who are such high volume that each one could handle its own residency by itself. I think in our case, the 4th year is not really going to be a huge benefit from what I've seen and from how I've seen the 3rd years handle massive caseloads, and as well as go moonlight and have no problem moonlighting. Sometimes even being more comfortable than the attendings that are there that they're moonlighting with. Other programs, I know of other residents who have troubles hitting central lines, have troubles seeing traumas and things like that. We do all that. We're done with that 1st year.
And so put a fine point on what Duncan was saying, just to really drive home the point of how many patients we have in our system. I believe Mountain View is something like 80,000 patients a year. Sunrise is something like 120,000 patients, which may not mean a whole lot to you guys
50.
applying. 150. I know at one point when you combine Mountain View and Sunrise together, we had the second highest volume of patients of any ER program in the country. I'm not sure if that stat is a little dated now, but
It was last year on EMRA's website. If you looked at their map, we had the highest volume in the country.
number one now.
Yeah.
Yeah. So again,
But
I know back when I was a med student, the number of patients per year, that didn't mean anything to me, but just to put a fine point on it, number one, apparently, number of patients we see every year.
And Sunrise just keeps seeing more patients, and so does Mountain View. We're growing at pretty rapid rate right now. It's been interesting. It's been very busy recently.
And on that note, just as we keep growing, we are not a resident run program. Every time I have a shift, every time Dr. Hart has a shift, we're seeing patients on our own as well. So we can pick and choose a lot of times the cases that are the most educational to the residents are the ones they're going to get. So if I have a third year with me later this week and he or she sees 20 patients, it's going to be the 20 sickest patients that we have. And I'll clean up the patients that have maybe a little bit less educational opportunity. Certainly not expecting our residents to see every patient that walks through the doors because, like I said, there's quite a few of them.
What do you guys look for on audition rotations? I feel like that's always a hot question for third years.
I'll tell you, what I care about is that you come in, that you're excited, that you work, that you want to see patients, that you're really pushing to get like the one-on-one experience with the patient. And when you do that, that you take ownership of that patient and you make it your own. And if you don't know something, you're looking it up, you're trying to figure it out. And having a good attitude the whole way through. I really care a lot more about attitude than I do credentials, although credentials help. I think one way that you can prepare is just to get one of those EM rotation prep books and just memorize it and have the answers to all the major questions, because the things that are low hanging fruit, you should know. And the things that are a little bit more esoteric, we don't expect you to know. Have the basics understood, and then you're going to come in and if you come in and put in a good effort and have a great attitude while you do it and you've got the basics down, you will look very good.
Yeah, I think you got to remember one day you're a fourth year and you graduated, and then the next day you're an intern. There's no like immediate transition time. One day you're just making orders. So you think of your visiting rotation as that's that day that you're now taking hold of that patient and you're the one who managing them from start to finish. We're here to help you. I think that's the important thing. But also attitude. If you're working with me and you seem like you don't want to be there, I don't want you to be there either. So if you're excited and you want to be involved in everything, you're not like hiding in the corner. That's exactly what we're looking for. We want somebody who wants to be there, who wants to learn. I'll teach you all day long, whatever you want to know if you want to ask for that.
I'm gonna throw y'all's social media link. I think I sent that to everyone. It's great. Everybody should follow it. You get to see the Christmas theme and the mountain biking. So everybody should follow it. If no one else has questions, I can hit you guys with some rapid fire.
It looks like there was one added on from Shane. He's a third year med student who's applying to rotate with us. And by the way, if anyone's interested in rotating with us, it's a website we use called Clinician Nexus, NEXUS. You can apply to rotate with us. He was asking about specifics on that. We're still in the process of going through those. We're actually in the process of switching program coordinators right now, onboarding a new program coordinator. So we're maybe a little bit behind there. If you have any questions specifically about the ER student rotation, I'm more than happy to answer those myself. Please just feel free to email me. It's my name, haydenmog@gmail. You can hopefully see the spelling there at gmail.com. haydenmog@gmail. I'm more than happy to answer any questions specifically about the rotation. And if I can't, I'll put you in touch with someone who can.
Yeah, Dr. Frank Lee runs that rotation, and I know he's very interested in making sure that we don't have big delays here. Consuelo is our new program coordinator who's starting in the next. She started today technically, but she's at a training in Nashville, I believe. She'll be starting up full bore going next week probably, and hopefully we should get you some answers back here in the next couple weeks. We apologize if there's been a little delay there. It's just been a lot to switching people, so.
Also, speaking of Nashville, one thing I don't think Dr. Hart mentioned this year, for the first time, all of our senior residents are being flown to Nashville actually in a week or two for an oral board prep course. All of our seniors, all expense paid hotel and flights to go for a 2-day kind of seminar in person to prepare for the oral boards, which back when I was a resident, I would have adored and jumped at the chance to do. A, because it's a great educational opportunity for the new oral board format, and B, because I'd get to hang out with some of my closest friends in Nashville. Nashville's a fun city.
The Southwest Regional EM Conference that you mentioned, did you say it's in January?
January, yeah. Usually the last Friday in January is typically when we schedule that.
Okay.
And if anybody's interested in that coming up next year, just email one of us and we'll make sure that you have the information for it. We should have kind of final info sometime around September or so as to when that's going to be. But yeah, it's a good event.
Do
You,
any,
and
go ahead.
sorry, and you as students are allowed to submit research to that, posters and things like that. So no matter where you're from, we would love to have your submissions. Come out and present to us.
Do you send any classes to any particular conferences?
Yes, we send let's see, that we're working on. Last year, we sent everybody to ASEP, all of the seniors, but ASEP was in Las Vegas. So we are negotiating that so that we can get them all to travel to ASEP next year. That has been something that they've given us a soft yes on. And so we're trying to get that hard yes for the future.
Do you offer any fellowships?
We have an ultrasound fellowship that is primed to start, and all we need is somebody to be our first fellow. So that's what we're working on.
There's also
We also have,
care.
oh,
Oh, yeah. Dr. Garner and two other alumnus are going to be in 2 rounds of Quick Care Fellowship also.
Oh, yes. So yes, critical care is available in our hospital through Dr. McWhorter, which started as a anesthesia critical care, but then was opened up to emergency medicine. So it's a 2-year fellowship.
Do you ever get to staff sporting events?
Dr. Mogg?
yeah, actually, this past year, I was one of the on-track doctors for the Formula One race that's here in town. If you're not familiar, Formula One is a racing series that goes all around the world, and they actually closed the Las Vegas Strip and they race down the Las Vegas Strip. So it's something that myself and Dr. Church and I were able to do. They let me drive a car down the strip going 95 miles per hour and no one arrested me. I was very happy about that. It's something that our senior residents have an opportunity to be involved with as well. I believe the plan is to have them work on pit lane, which is where a lot of the action happens. That's certainly something that you're able to get involved with. We also have residents who've been involved with EDC, which is a big music festival here. I'm forgetting a couple of the other big ones. The Las Vegas Marathon, I think our residents have worked on. You guys, am I forgetting anything?
No.
Any golf?
Golf. We are not medical on golf.
Yeah.
That I'm aware of.
Boy, should we be.
That would be a good way
You hurt
to
golfing.
get, yeah.
Yeah. Is there like a sport that you guys are competitive with within your program or against other programs?
Oh,
Mm.
I would say we do not have any ongoing rivalries with any of the other programs here in town, but I would say that like we have a very strong mountain biking and rock climbing contingency in our residency. So if anyone is interested, we can get you seeing. I don't know if you know this, but Red Rock has some world-class rock climbing. People come from all over the world to do Red Rock, especially trad climbing. If you're interested, if that's like a passion of yours, it is awesome. And then also within a 2-hour drive of here is some of the most incredible rock climbing and mountain biking in the world. So,
Yeah, we play
You-
pickleball too.
and
I was gonna
pickleball.
say, that reminds me of pickleball.
Yeah.
Yeah.
Do you have a lot of people with families that come in, and what does maternity leave look like?
Very much. I don't know if anyone else wants to. So yes, we have lots of people who have families in our residency, maternity leave. So ABEM, ACGME and ABEM, they allow for 6 weeks of maternity without taking a penalty. I believe that HCA offers 8 weeks of maternity leave that is paid per per year, I believe, is what they allow for. Obviously, if you're going over the ABEM requirements, then you'll have to extend out your residency. But we're here to support you however you want that to work for you. But yes, we've had people, both female and male, have families. We had a resident graduate recently who had 5 children, and he managed to make it work and looked good doing it. So yes, it's a priority for us to make sure that feel like you can be a good husband, father, mother, wife to your family. And so we try to work with you to make sure that we can achieve that while you still get a good education and things are fair with your fellow colleagues.
Okay. We are almost at the end of our hour. This session is recorded, so we had a lot of people register that I'm assuming will take a look at that recording. So I really appreciate all of you taking time from your schedules to tell us more about your program. Any last thoughts from any of you guys?
No, just come check us out. We live in an awesome place with awesome training. If anyone has any of the further questions, or if you're watching this back in the recording and you want to know something, please feel free to email me. Like I said, it's down haydenmog@gmail.com. I'll answer anything I can do for you guys.
And I think, a lasting point, Dr. Mogg and Dr. Hart are both going to be pretty humble, but the thing that I think is special is like the attendings, is the people. This is a wonderful place to come. Even other class alumni that are not technically within our program are still excellent resources and wonderful people, and will take you underneath their wing just as much as if they were core faculty. So I think it's the people, it's the experience. So come hang out. We're fun.
It looks like it from the social media. Everyone should follow it. Okay. Thank you guys so much. Really appreciate it. And yeah, thank you.
Yeah, thanks
Thank
for
you
having
so much. And thanks for giving us this opportunity.
Absolutely.